brand is not what you say it is, a brand is what they say it is. So a brand is not a logo, it's not a slogan. It is in fact a gut feeling. And so when enough people arrive to that same gut feeling, then you could say that you have a brand. And my role as a marketer and your role as eventually a business owner or the dentists here that already own a business is to influence people to feel the same gut feeling for your company. And you do that through many different elements. And that could be from the moment a patient calls into the clinic and the receptionist answers, to price points in your treatments, to your core message on social media. So all of this makes up a brand. Now, today I'm going to be illustrating some of the things that I have done through a very brief case study, really, which is C4 oral surgery. I'm sure you know some of these, some of the doctors here, Dr. Antoine Shahadi, Dr. Mark Shanuda. They might have been your professors, or you might know them as colleagues. And so I've been managing all of their digital marketing for a while. And so I would just want to show what we've done through them. Now I want to talk about what is digital marketing. Digital marketing is composed of mainly 6 points. One is your online reputation management. That's something quite important for dentists and doctors alike. Email marketing, which is really e-newsletters that would go out to patients or to referring dentists. Analytics, which is the beauty of digital marketing. You could actually get a lot of data to understand what is working and what is not, to adjust your tactics. Your website, which as we will see, it becomes the core of all of your digital marketing. About 95% of all the activities in digital marketing are sending people back to your website. SEO, which is search engine optimization, and SEM, which is search engine marketing. And also I will talk very briefly about that. And finally, social media. And I'm just going to show you. I want to share with you some healthcare marketing insights that are important to your field. 72% of online users say that they looked for health information in the past year. Now, the 3 most seeked out topics were diseases, treatments, and health practitioners or dentists. So you really have to think about being there. You have to be present where people are searching for different things. 77% of online health seekers say that they began out of course Yahoo and Google and Bing last year. Now, the dental professionals that are making the most use of digital marketing are orthodontists at 92%, using social media, using Facebook in particular. And then finally, amongst all the different industries, the dental industry is the one that has the highest percentage open rate for email marketing. So if there is something that you want to do within your digital marketing strategy, is include email marketing. Now, where do you have to start? Where do you think you have to start in digital marketing? Yeah. So you have to start with your website. So your website is really the hub of communication for everything that you do. It should be considered as a storefront that is open 24/7, and it should be a place where you're actually showing your brand and what it represents. Now, as I mentioned before, your website is where you're redirecting a lot of your traffic. So about 95% of all the different things that you're doing as part of your digital marketing strategy are sending people back to your website, and when they get to your website, you want them to convert. And what does convert mean for a dentist? It means to book an appointment. So you want to be sending patients back to your website, hopefully to a landing page that says, book an appointment now. So that's what you're doing with your digital marketing strategy. Everything online, you're doing that. Now, your website has to be created for two people, or two users. One, human beings, of course, and the second one is search engines. Now, for human beings, you need to make sure that they have a positive user experience, and that means having very clear call to actions, like a request an appointment right away, or you call today, so that they can easily find what they are looking for within a number of seconds after they come onto your website. You also want to make sure that your website is being built for search engines. So you want to make sure that all the back end of your website is done very well so that search engines can actually read what your website is about and rank you. And we're going to be talking about ranking and why that is so important. I'm sure all of you know, though, that you need to be on that first page of Google.
Can you just define back end for some people who don't know what that means?
So what the back end means for a website is that you need to make sure that a programmer is writing something that is called meta tags into your website, and it's a form of speaking to search, so to search engines, and telling them, for example, this page is talking about dental implants, and we just updated it, and we just updated a blog that talks about I don't know, the 5 benefits of dental implants. And so that's the way to actually communicate back with search engines. That's the back end, more or less. Okay. The other thing is that, of course, websites have to be mobile optimized. So in this day and age, there's only about 45% of North American websites that are mobile optimized. So there's a huge amount of websites that are giving the patient, let's say, a very negative experience. So once you go onto a website on your cell phone, you can't really see the images properly, you can't navigate it, so you want to avoid that.